Good afternoon, my name is Todd Hart, and today I'm going to be performing a head-to-toe assessment. Before I get started, I'm just going to give a little summary of the patient's general appearance. The patient is in good health, does not appear to be in any distress. Skin color is pinkish brown. He is tall and slender build. He has erect posture, correct alignment. He has normal motor and gait. He is neatly dressed, well groomed, and good hygiene. He has normal relaxed facial expressions, and his speech is clear and appropriate. Alright, to start off, I'm going to be assessing the skin, the hair, and the nails. I'm going to begin by looking at the skin. Skin is pinkish tan in color, absent of any lesions or masses. It's warm, dry to touch, has good skin turgor. Next, skin slightly movable. Now I'm going to look at the nails. Nails are pink and round, well manicured. I'm going to apply slight pressure to the nail bed to check for capillary refill. Capillary refill is less than 3 seconds. I'm going to do it up here on this hand. Capillary refill less than 3 seconds. Alright, now I'm going to look at the toes as well. Look at the toenails. Alright, nail beds are pink in color. Alright, capillary refill less than 3 seconds. Alright, capillary refill less than 3 seconds on this one as well. Next, I'm going to be looking at the patient's hair. Patient's body hair, it is thick and evenly dispersed throughout the body, smooth and fine in texture. Now I'm going to be looking at the patient's head. So I'm going to inspect first, just look. Now I'm going to palpate. Patient's head does not feel any masses, lesions, or bumps. His hair color is brown, smooth texture. Alright. Now I'm going to be looking at the patient's, I'm going to assess the lymph nodes. So I'm going to start with the occipital. So, alright. Now the post-auricular, pre-auricular, tonsillar, submandibular, submental, and the anterior clavicle, posterior clavicle, cervical, posterior cervical and anterior cervical, and the supra-inferior, the supraclavicular lymph nodes. Alright, now I'm going to be looking at the patient's eyes. First, I want to test the patient's visual acuity. So, if you could take your hand and cover your eye, and on the wall there, read the bottom numbers if you can, bottom letters.
D-E-F-P-O-T-E-C.
Correct. Now do it again with this hand.
D-E-F-P-O-T-E-C.
All right. Now I'm going to test the patient's visual comprehension. So I'm going to look straight towards me, and when you see my fingers wiggle, say, let me know.
No.
Okay. Same thing.
No.
All right. Now I'm going to be assessing for extraocular movements. So just follow my finger, look straight at me, follow my finger. Alright. So he has full range of motion in the extraocular movements. Now I'm going to be looking at the patient's midline corneal reflection. So let me get a pen light. And I'm going to look at the cornea. Alright. Now I'm going to test for convergence, so look straight at me, follow my finger. Alright, very well. Now I'm going to inspect the patient's eyes. So look straight at me. Alright, eyes are symmetrical, proper alignment, eyebrows look symmetrical, eyelids are good, symmetrical. Now I'm going to look at the conjunctiva. So, sclera looks good in both eyes. Now I'm going to look at the cornea, the lens, and the iris. Now I'm going to check for pupil reaction and accommodation. So look at me. I'm going to shine this light in your eye. Alright. And over here. Alright. So pupils are equal, round, reactive to light. They are 3 millimeters, and they constrict to 2 millimeters. Next, I'm going to be looking at the patient's eyes with the ophthalmoscope. Alright, if you could, look straight at me. Alright. Red reflex present. Alright. Now I'm going to palpate the lacrimal apparatus. No swelling or edema present. No tearing. Alright. Now I'm going to be looking at the patient's face. So, to begin with, I'm going to get you to clench down on your jaws. Alright. You can relax. Now, can you raise your eyebrows for me? Alright. Can you frown? Alright. Can you quench your eyes closed? Alright. Can you smile? Can you show me your teeth? Alright. Can you puff out your cheeks? Alright. Good job. Now I'm going to be looking at the sinuses, the frontal and the maxillary. I'm going to inspect and then percuss. Sinuses, maxillary, and I'm going to percuss. All right. Now I'm going to be looking at the patient's neck. I'm going to get him to do range of motion for me. Can you turn your neck side to side, up, down? All right. So range of motion's intact. Now I'm just going to palpate the muscles, inspect and look at the muscles. Any soreness or tenderness present?
No.
Alright. So, palpate and look at the muscles. Now I'm going to give the patient's look at the spinal process and the shoulder muscles. So, now I'm going to get you to shrug your shoulders for me. Alright, now I'm going to put my hands on there and now shrug them. Alright, so patient's able to shrug shoulders against resistance. Now I'm going to be looking at the patient's thyroid and arteries, carotid arteries. So I'm going to listen to your carotid arteries. Now I'm going to inspect the thyroid. Can you look up for me? Can you take a swallow for me? Alright. You can relax. Now I'm going to inspect from the back. Alright. swallow for me again? Look up, swallow for me. Alright, thank you. Now, I'm going to be looking at the patient's ears. So, I'm gonna palpate the trachea. Alright, no saw. Look at the outer ear. Look at the inner ear. Now I'm going to get the otoscope and look inside the patient's ear. Alright. Alright. Same for this side. Alright. So, inspect the inside, the internal and external ear canal. Now I'm going to be looking at the patient's nose. So I'm going to look for symmetry. Alright, I'm going to feel. Now I'm going to inspect inside the patient's nose. Could you look up for me? Alright. Alright. Now I'm going to be assessing the patient's mouth. I'm going to be looking at the lips, the gums, the mucosa, the teeth, salivary glands, and all that. So let me get some gloves on. The tongue depressor. Alright. Begin by looking at the patient's lip, just inspecting and palpating. Alright. Patient don't have any lesions or sores. Now, I'm going to inspect the gums and the teeth. Can you open your mouth for me, sir? Alright. Now, I'm going to look at the back of the patient's throat. Say ah. Alright. Now I'm going to move the tongue to the side and just look for any lesions or masses. Don't see any there. Don't see any there. Raise the patient's tongue up. Alright. Can you stick your tongue out for me? Alright. There you go. Now, I'm going to test the patient's taste. We've got some lemon swabs here. Alright.
Tastes like lemon.
Alright. Now I'm going to be looking at the lungs and thorax. So if you could you come around and sit on the opposite side of the bed for me? Alright. So I'm going to begin with inspection of the AP diameter. Now I'm going to press. Alright. Now I'm going to check for symmetry. Can you take a deep breath for me? Alright, relax. Alright. Patient has symmetrical chest movement. Now I'm going to check for tactile firmness. So I'm gonna place my hands on your chest, sir, and get you to repeat 99, 99 for me until I tell you to stop.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
All right, very good. Now I'm going to check for the diaphragmatic excursion. Okay. All right. So now I'm going to auscultate the lungs. Deep breath. All right. Another deep breath. All right. Alright. Now I'm going to get you to lay down for me. And I'm going to inspect the anterior chest. Alright. Raise your gown up for me. So to begin with, I'm going to inspect the symmetry. Alright, we're going to percuss. Alright, now I'll get you to repeat the 99, 99 for me again.
99, 99, 99, 99, 99, 99.
Alright, now I'm going to auscultate the lungs. Alright, clear breath sounds. So now I'm going to be looking at the patient's breast. So I'll begin by inspection. Alright, now I'm going to palpate. Any tenderness?
No.
Alright, so no tenderness, nipples absent of discharge, they are pinkish in color, areolas are even. So now I'm going to look at the axilla, so I'm just going to palpate. Alright, there we go. Now I'm going to move on to the heart. So I'm going to begin by inspecting, looking for the apical pulse. Now I'm going to feel. Alright, now I'm going to press. Now I'm going to listen to the heart. Now I'm going to check the pulses. So I'm going to palpate the carotid arteries one at a time. Feel the radial pulses. Alright. Now I'm going to inspect the abdomen. So look at the abdomen. Alright. Skin color is normal. Alright, I'm going to begin by light percussing. To palpate lightly. And do deep. Alright. Now I'm going to listen. Alright. Now I'm going to palpate with the femoral arteries. Now I'm going to listen. Now I'm going to be assessing the vascular system. So I'm going to be first looking at the arms, make sure that they're symmetrical in size and shape. Alright. Skin tone, pinkish brown. Hair is evenly distributed. Alright, same here. Now I'm going to look at the legs. Alright, just raise your legs for me. Alright. Good tone. They appear to be symmetrical, same size and shape. Skin's pinkish brown, same tone. Alright. Now I'm going to palpate the arteries. I'm going to begin with the carotid. Right here. Check the leaves. Posterior tibia. Alright, relax that leg. Alright, now I'm going to check posterior tibial. Alright. And then the dorsal pedius. Alright, so all pulses are present. They are 2 plus, strong and equal. Now I'm going to assess the musculoskeletal system. So you can sit on the side of the bed for me, sir. Alright, so now I'm going to get the patient to, I'm going to assess his gait, so I'm gonna get him to stand up for me. Alright, and just walk a few steps forward for me. Alright, now back. Alright, you have a seat right here for me. Now I'm going to check the joints and for range of motion. So can I get you to, let me see your hand, move your elbow, alright, your wrist, check your fingers. Alright, same here. Get you to move your shoulder for me. Alright. Same here. Alright. Now I'm going to check your knee. Get you up. Alright. Then I'm going to get you to look at your neck, kind of like turn your neck. Alright, full range of motion there. Now we're going to assess the ankles and feet, but I don't know if we're going to get those in the view of the camera. So kind of see if you can raise. Yeah, there we go. So we're gonna. Alright, raise this one up. Alright, there we go. Now I'm going to palpate the joints and also test for strength. So and I'm going to push against me. Alright. Same here. Alright. Now pull up. Alright. Same here. Pull up. Alright. Shrug your shoulders up. Alright. Now I'm going to apply pressure on your knees. I want you to raise your knees up. Alright. Now, same for the ankle and feet. Let's bring them up again. Alright. Push down on my hand. Alright. Now push up. Alright. Push down. There we go. Push up. Alright. There we go. Now, I'm going to look at the spine. Now can I get you to turn side to side for me? Alright. Very good. Now I'm going to look at the TMJ. So, alright. There we go. Now we're going to inspect the neurological system for muscle coordination and balance. So first, I want you to close your eyes for me, and I want you to hold your arms out to their side, like this there, and keep them there for me for a few seconds. I'll tell you when, okay? Okay, you can relax. Now, I'm going to test fine motor function. So, you can open your eyes. I want you to take your index, your pointer finger, and your thumb and